Good morning, good afternoon, or good evening to all participants from all around the world. Merhaba. Merhaba means hello in Turkish. And hello, everyone, and welcome to our second day of our webinar series in the European Public Health Week. Uh, European Public Health Week aims to raise awareness about public health and promote collaboration among the public health community in Europe. European Public Health Week is an annual initiative organized and coordinated by the European Public Health Association, and it began in 2019 and keeps growing. And this year, it's the sixth European Public Health Week. Public Health Week is taking place. We started yesterday, May 13th, and until end of this week. And the main title of this year is the Health is a Political Choice. And as you know, these webinar series are organized by Society of Public Health Thinking and Innovation. In other words, HADI, H-A-D-I, from Turkey, and in collaboration with Istanbul Medipol University. You know, mental health is one of the current hot topics in public health, and mental health problems have been increasing in the burden of disease. And today, our main subject is mental health for all, immigrant access to mental health care. And today, before starting our presentation webinar today, you know, immigrants face multiple stressors that may cause or exacerbate mental health problems, but they access less to mental health services compared to general population in the countries. And to address these disparities, we can work towards ensuring that all individuals, regardless of their immigration status, have access to mental health support they need. So today, we have two brilliant speakers, Yasemin Denizli and Yusuf Özdemir. Let me first introduce Dr. Denizli. Yasemin Denizli is a PhD candidate in the Department of Public Health, University of Health Science in Turkey. Her primary research focuses on mental health, immigrant health, health education, and promotion. Dr. Denizli earned his MD degree, Doctor of Medicine degree from Istanbul Medeniyet University in Turkey. So I would like to invite Dr. Denizli to share her presentation with us.
Thank you, Ömer. Can you see my presentation right now? Okay. Today we are going to talk about immigrant access to mental health services with Yusuf Özdemir. First, I want to do a small introduction. Mental health is a fundamental aspect of overall well-being, not for just immigrants, but overall for all human beings. And yet, immigrant populations often encounter significant barriers in accessing appropriate care. We know that immigrants face different stressors, which is unique to their situation. And these situations sometimes that may exaggerate or cause some mental health problems. But access rates, when we look at the data, their access rate are far below the general population, which leaving them at risk for untreated mental health conditions. They can face with lots of barriers like linguistic, cultural, and socioeconomical challenges that may impact to able to seek and get mental health services. And today, when we are exploring immigrant access to mental health services, we aim to put a light on these barriers and also discuss some potential solutions. We hope that by addressing these disparities, we can toward to ensuring that all individuals, regarding that their immigrant status, have access to mental health support and services that they need. So first, I want to talk about the common challenges and barriers they can face. By the way, I want to highlight that immigrant populations, uh, they come from different backgrounds, from different cultures, and they become immigrant in different situations. So it's a really heterogeneous group, but even then, they have some commonalities that we can see. And in here, we are doing some generalization, of course, sake of the presentation, but they have a really different challenges they can face. One of the biggest challenges immigrants face is language and communication barriers. They really find challenging to seek in mental health care because of their lack of language preferency. For example, even they know the language, sometimes cultural nuances and levels of preferency affect to understand themselves, to be expressed themselves, also to understand treatment options. In my research, I'm doing research on Turkish immigrants living in the US. I'm going to talk about my research, but the main things I saw in the interviews was even some immigrants knew the language. They found hard to express themselves because of the different cultural nuances. So because of that, it's really important to uh, provide culturally and linguistically, not just linguistic, but also culturally appropriate services tailored by the diverse backgrounds of immigrant populations and to address these barriers effectively. Understanding cultural context is important, like I mentioned. Offering services in multiple language, yeah, it's the one of the side of problem, but also understanding cultural context in which mental health issues also important to understand and address uh, the challenges they face. And the other topic, one of the common barriers that we see is cultural stigma and mistrust. Cultural stigma surrounding mental health is one of the big challenges within the immigrant communities, and most of the time it's deeply rooted in their cultural beliefs and attitudes. They may see the mental illnesses as a taboo subject, so they can maybe they will never talk about it at all because of the cultural because of their cultural beliefs and attitudes. Also, they can see as a sign of personal weakness. Most of the time, because of the cultural barriers they face, it can influence their perception on mental health, such as stigma associated with seeking help for psychological distress, or sometimes they can fear being criticized by their community. Like, are you mad? Do you have a problem with your mind? So these things really affect immigrants uh, immigrants seeking mental health in the first place. Also, these cultural norms and beliefs often contribute to a sense of mistrust towards mental health services, leading the immigrants to avoid seeking help. And most of the time, if their symptoms become so severe, then they get help. Before it, they just don't get it because of the mistrust. So addressing this cultural stigma and mistrust requires a comprehensive approach, not just within in health services, but a more broader perspective, collaborating with immigrant communities, with NGOs. We need to address more comprehensive way if we really want to do effective solutions. Also, promoting mental health awareness and the stigmatization is also important. Immigrants often face disparities in mental health care because of the socioeconomic factors like their income level, their education, and their employment status. Their limited financial resources often becomes an obstacle to accessing mental health services, like high costs associated with therapy sessions, psychiatric medications, and other treatment modalities can place a significant barrier. Especially because I'm currently living in the US and I'm working on US health system. I know in Turkey and in UK and in other Europe countries, in most of them, they have a more wide range health coverage. But in here, you need to pay for to get your health coverage. So it's really become a big obstacle if you have some financial restriction. Also, lack of insurance coverage is one of the biggest problem. And even you have some insurance coverage, most of the time it's not covered. Your therapy sessions, maybe some of the treatments won't cover because of the your restricted insurance. So even if you have insurance, you can find hard as an immigrant to access these services. Also, employment instability we see really frequently among immigrant communities because of the language barriers, lack of recognition of foreign qualifications, and discrimination. So employment instability not only impacts financial instability, but also disrupt to access employer-sponsored health insurance. In US, most of the time, if you have insurance, it is an employer-sponsored health insurance. And if you have a employment instability, probably it will disrupt your health insurance plans and other benefits, including your mental health coverage. There's a systemic review of research on mental health service use among immigrants in the United States. And in this research, they studied 62 articles, and they found that immigrants, especially from Asia, Latin America, and Africa, use mental health services lower than non-immigrants, despite an equal or greater need. And the lower usage found more related among men and insurance immigrants and undocumented immigrants. When they looked for structural barriers, they found that lack of insurance, high cost of services, and language barriers, one of the biggest structural barriers. Also, studies have shown that social support is one of the important factors for immigrants, that those who seek help for mental health conditions, because most of the time they turn first to their families, their friends, or religious leaders. So after talking about significant barriers and challenges immigrants that may face, I want to talk about some promising practice and solutions on this topic. One of the biggest things I think we can do in the realm of mental health care is a cultural component care. It's really important to know that immigrant communities often hold distinct cultural beliefs and values, especially when it comes to the mental health, which may differ from mainstream perspective. So if you want to serve as a health services, a cultural component care, we need to know that their cultural understanding. Cultural competence enables mental health professionals to respect these diverse cultural norms, and we can foster trust, and we can support better these immigrant communities. Also, effective communication is one of the cornerstones of quality mental health care. Cultural competence providers, they can overcome these linguistic and culture barriers, and we can have more open and empathic communication with immigrants. And tailored treatment, because we know that in medicine, one can't size fits all, especially in mental health. So these cultural competence allows to the healthcare providers more cultural sensitive interventions, and it will affect probably it will affect their seeking mental health, also their motivation to seek treatment. So how we can do this with training programs, mental health professionals can participate these cultural competence training programs, uh, which offered by organizations and institutions. These programs provide education on cultural awareness and effective cross-cultural communication. Also, language access services like interpretation services, translated materials can help to overcome these language barriers in mental health care. Uh, and community engagement, I think this is one of the important, one of the biggest important things we can do. Collaborating with immigrant communities and community-based organizations is one of the key to build cultural competence. Because if we want to make them trust these services, I think they need to feel that we understand them, and we really want to help them. And these immigrant communities, community-based organizations is really helpful. Also, multicultural team approach, adapting more multicultural team approach in mental health care settings will foster more broader perspectives and experiences. I want to talk about my dissertation research. I'm working on mental health status, associated factors, and barriers to accessing mental health services among Turkish immigrants living in the US. It's a mixed method study. I did a survey, also interviews with immigrants. In the survey part, 210 Turkish immigrants joined to the survey, and I conduct interviews with 14 immigrants. In this survey, we looked for socioeconomic factors, immigrant-related factors, and general health questionnaire 12 scale to be able to measure their mental health status. And in interviews, we try to explore participants' mental health stressors, their coping strategies with stress, their experiences, and their barriers to accessing mental health care. As a result, we found that 64% of participants were women with a mean age of 39 years. Most of them were married, and 67% of them had graduate level education. It's different from the Turkish immigrants living in the Europe, because of the different reasons to immigrate. in here in the United States, most of the time Turkish immigrants came here for education, for better job opportunities, and we see more high graduate level education status between Turkish immigrants. 60, 56% of them had full-time jobs. And when we asked, did they experience any stress or stress-related symptoms after migration, 40% of them said yes, but only 22% of them they seek for professional mental health. And when we looked for their mental health status with a general health questionnaire 12, we found that almost half of the participants had a higher general health questionnaire scores above the cutoff values, which shows that they have risk for mental health conditions. And we looked for the association between higher general health questionnaire scores. We found that not having US citizenship, having a temporary visa, living in the US less than 10 years, less satisfaction with life in the US, regret from migration decision, perceived poor physical health, perceived poor mental health, not being married, not being employed, having lower income, and being younger age was related with higher scores, which means that they had more risk for mental health conditions. And in the interview parts, as a result of interview parts, we tried to collect under 4 main teams and under 4 sub-teams their opinions and experience regarding mental health and mental health services. And the first team was stressors after migration. We found that separation from family and society, cultural differences and lifestyle changes, exposure to discrimination, education and work difficulties are the main stressors that immigrants face after migration. And the second team was methods for coping stress. We asked them, how do you cope with stress? And they said that meeting with family and social circle, having some hobbies and social activities, founding some personal and spiritual methods, avoiding from problems, and limited access to mental health services were the methods that they found as a coping strategies. When we asked to the participants what were the barriers in accessing mental health when they were living in the US, and they said that the high cost of health services, cultural barriers, communication barriers, lack of the information that available resources, difficulties in transportation to appointments, long waiting times were the main sub-themes we found as a barriers that they face to accessing mental health services. And we also asked the participants, do you have any suggestion to facilitate accessing mental health services? And they said that promoting of services that provide language and cultural compatibility, information and guidance about existing health services, and reducing or removing these legal and economic barriers are the main sub-themes we found. We found actually similar themes, sub-themes, and results regarding to the Turkish immigrants. We found that there were similar results that we see in other immigrant communities living in the US. And as a conclusion, we intend to share these findings and our recommendations with these findings with the Turkish communities, also those who serve Turkish immigrants as a mental health professionals and providers. From here, I want to give the microphone to the Yusuf. This is the all I want to talk about with you.
Thank you, Dr. Deniz. It is insightful and one of the most updated research about mental health on the immigrants. And before our next presenter, I would like to remind that if you have any question, please feel free to write your questions either through chat or QA session in the Microsoft Teams. And at the end of the second speaker, I'm going to share your questions with our presenters. Now, it's our second speaker's turn. Dr. Yusuf Özdemir is a PhD researcher in the health economics unit at the University of Birmingham. His current research focuses on the public mental health, health attitudes and behavior, healthcare resource management, and global health. Dr. Özdemir earned his MD, Doctor of Medicine degree from Istanbul Medipol University in Turkey and Master of Science degree in Global Public Health and Policy from the Queen Mary University of London. So I would like to invite Dr. Özdemir to share his presentation with us.
Thank you, Ömer, or as we say in Turkish, Ömer abi. I'm just trying to find, there are lots of, I'm just trying to find my presentation between the screens. Yeah, I think this should be the one. Can you see anything?
Yeah.
Okay, I think this is the one. Yeah, let me check. And now I can move it on. I don't know why. Okay. Yeah, now it's moving, right?
Mm-hmm.
Okay. Thank you very much. It's a good opportunity for us to talk in the European Public Health Week on these topics. I should mention that this is not my main field of expertise. I mostly work on school and workplace mental health, priority setting, and healthcare policy. So most of these are Yasemin's work. She has done most of the effort. I would like to thank her for this one. I just want to add some other possible solutions and some other policies to help overcome the problems and challenges that immigrants face about their mental health. One of them is community-based initiatives. I know it's common around in Turkey for mostly for Syrian refugees and other groups, but it's getting popular even in developed countries as well, with I don't know, small number of immigrants. So we can define these programs and initiatives as like grassroots efforts designed to address the mental health needs of immigrant populations within their local communities. They can be faith-based groups, cultural centers, like local authority managed centers, or different collaborative partnerships between various stakeholders, including healthcare providers, the health system, social service agencies, and advocacy organizations. So there's not a very, narrow and clear definition for it. Rather, it's a larger definition for lots of different initiatives. You can call them charities and NGOs as well in different settings. So they can, these initiatives can offer different type of services, including culturally sensitive counseling that Yasemin already mentioned, education workshops, raising awareness about mental health issues. So there are different kinds of things they can do. But these things are not just limited with mental health. According to American Psychological Association, the legal assistance, social assistance, or educational assistance are also parts of these services that can help people in their communities. And when they have done together, these all services, how can I say, when these all services perform together, and when immigrants can reach all of these services, actually, there's an increase in the use of mental health services as well. So all these pillars are important for mental health promotion and prevention efforts for immigrants as well. So mainly we can say, and as an alternative to clinical-based services, community-based mental health services address the larger context of immigrants' lives within their communities. So helping them all of different problems, including bureaucratic processes or how can I say, their feeling of judgment or fear or discrimination about anything in their community, or their socioeconomic status. So different kind of things. Those assistants can help them. Especially educational settings could be helpful for the children to reach mental health services, because usually families, especially immigrant families with low socioeconomic status and maybe low educational status, because of the stigma around mental health, they sometimes tend to not reach the mental health services for their children. But the educational settings makes it easier and a safer and familiar setting, as a safer and familiar setting for them and their children to reach those services. So it's a good link for an efficient link for the immigrants. Another alternative solution or additional solution could be the telehealth opportunities. So telehealth means like, it's again, it has a wider definition, but it encompasses a range of digital platforms and technologies that enable remote delivery of healthcare services, mainly we can say. It can be like video conferencing, telephone calls, secure messaging platforms, internet platforms, mobile apps. But the important thing when we are providing those type of services is these services should be convenient for immigrants again, and of course has to offer confidential access. But thanks to recent laws, especially in Europe, but around the world, most of these services already have high standards on confidentiality, so it should be not a problem for the providers. So it offers, the telehealth services offers mainly increased access, of course, like overcoming the geographical barriers and other barriers within the cities, especially big cities that immigrants might encounter while accessing the mental health services. But also it might help them feel more safe, or maybe it might be even more confidential for them, because visiting a mental health service point might even be stigmatic for an immigrant. So in terms of confidentiality and reducing the stigma, these services can help. Of course, these services offer some flexibility on scheduling appointments, so it can be more convenient for certain people, especially if they are busy working immigrants in different countries. And again, in terms of cultural sensitivity, we should be focused on this, like all other service types. But these platforms sometimes can offer us some like translation options and different language options, or access to different mental health services for out of the country even. For example, in the UK, the country where I'm living in, sometimes Turkish people access to mental health services via links in here, but to the psychologists and psychiatrists living in Turkey or in other countries talking their language. So this can be another option to improve the cultural sensitivity of the mental health services for immigrants. Finally, actually, I have another presentation, but I also would like to mention some policy recommendations generally for the countries or the organizations that would like to improve the service and the conditions for the mental health of immigrants. I think increased funding definitely one of them. I know we are living in a cost of living crisis, as the British says, or economical crisis, or kind of inflation era, and money is a problem for every type of health service nowadays. But definitely the mental health services for immigrants and even for the general population, I think needs increase in funding, including the insurance coverage expansion for immigrants, but also the integration of mental health into primary care, because the mental health is not linked or integrated properly into the primary care in most of the countries, as far as I know. Cultural competence training, both for language and also cultural knowledge, would be definitely helpful, both for the providers and the immigrant populations that access these services. And as we mentioned, the community engagement, not just the role of community initiatives, but also educating the general community, all population in a country, about what immigrants live, how immigrants live, what they experience, why are they disadvantages, and why are why they are not guilty of the situation they are in. So those type of things, and reducing the stigma around immigration and around mental health is important. So it would help for better solutions as well. I also would like to mention some legal and ethical considerations. I'm not an expert on this field. There are lots of lawyers working on this field for many years, but among other things, like financial issues and stigma, the immigration status, legal status, is one of the main important things that affects immigrants' mental health. I think Yasemin's study also showed that. I even myself experiencing this in this country. I'm here with a visa, just only allows me a kind of limited research and study. Even though it's not my main plan to leave this country forever, it affects me on every step of my life in here. And I'm sure that many other immigrants, especially the ones with a low socioeconomic status, definitely affected by those things. And almost all of my friends, which are not citizens in here from different countries, the immigration status of them and all these legal processes affects their mental health directly. And we need to consider these status both to, how can I say, be able to offer them better services, but also to understand how it affects their mental health. Of course, on every step, we need to be sure that the services and our approach should be confidential, and we need to receive the informed consent of the patients and participants to our services via their native language, if it is possible. So yeah, to conclude, I just would like to summarize what we have mentioned today. My part was a bit shorter than Yasemin's, but yeah, mainly Yasemin examined the multifaceted challenges faced by immigrants' access to mental health services, including language barriers, cultural stigma, socioeconomic factors. I also mentioned legal and ethical considerations a bit. In terms of the solutions part, of course, the culturally competent care was one of the most important, maybe the most important one, to communicate with immigrants about their mental health. Also, community-based initiatives, telehealth programs, and other general policy recommendations to improve immigrants' access to mental health services were promising, and I hope we can follow in our countries those steps. Advocacy, reducing stigma, those type of things are the things that all of us, not just health professionals or the higher managers of the system, all of us can do something about those topics. I just want to mention finally that addressing immigrants' access to mental health care is not just on a matter of social justice. It's not just for them, it's for us. I'm an immigrant, but I'm just talking as a Turkish citizen for Turkey, but everybody can say for their country. It's a thing that improves our overall well-being and social feel of social equity. So why I'm investing in and doing something about immigrants' access to mental health care, we contribute to a healthier and more resilient community for our today and future. And thank you for today, and thank you for this opportunity. And I would be happy to hear your questions as well. And thank you for our group organized these sessions. Yeah.
Thank you, Dr. Özdemir, for your presentation. Now we have almost 15 more minutes for questions and the discussion. And we have actually two questions from the same participants. Let me read. Then I would like to hear your opinions about this. Thank you for your the question is from Sabanur Çavdar. Thank you for your presentation, Dr. Denizli and Dr. Özdemir. I would love to listen about Dr. Denizli's research in the future. My questions are, the first one is, as young Turkish immigrants, what are your coping mechanisms and proactive activities regarding mental health? And second one is, what would be great if it was provided by your social network from Turkey? She also added that I would love to hear Dr. Atak's thoughts on this. Thank you. But before me, I would like to give the word to our speakers. Before that, I should inform all participants that all of us, I mean the two presenters and me, are living outside of Turkey. That's why Sabanur Çavdar asked this question. Please, Dr. Deniz, you can start with your thoughts, then Dr. Özdemir, and finally me.
It's a really good question. Even before doing my research, I want to choose that topic because I knew that I'm going to be immigrant too. So I can feel how they feel. I can more relate with them. Yeah, I'm living similar things with Turkish immigrants too, as I'm living in the US. And how I cope with this stress, what are my proactive activities? I'm trying to integrate with the community in here, especially with Muslim community. It's really helped me to easily participate to community, and it's really helped me to able to understand and connect easily. And also, I'm really glad that we have technologies that we can connect with families and friends through internet. I think it was really helpful for me. Otherwise, I would be more maybe sad, stressful, that I'm not seeing them or not communicating with them. So I think these are the two main things really help me to cope with stress. Other activities that I do, I'm trying to uh, understand the culture that I'm living in. So yeah, of course, I'm a Turkish person, so that I have things that I brought from my culture, from my country, but also I want to be open to their culture. So I'm trying their foods. I'm trying to, listen their music, trying to do the activities they do. So I think also this is really important um, to more. They call it acculturation. It's really help you to more easy to associate with the culture. And what would be great if it was provided by your social network from Turkey? I think I'm really lucky on this on this wise too, because thanks to my university, they were really supportive to do my research in the US from remotely, because my university in Istanbul, and they were so open and they were so supportive to be able to do it. So it was really helpful for me. I'm also trying to connect and trying to participate as much as I can to the online meetings from Turkey, which was also helpful because I didn't feel like I cut my all relations from Turkey. Like Hadi group, I think it's really supportive. Uh, People in the group were still are really supportive in lots of areas, and I'm really glad for it.
Thank you. So, Dr. Özdemir.
Thank you for the questions. I'm sorry for my voice today again. Uh, I don't know, about first question, what are your coping mechanisms and proactive activities? I'm not sure it's possible to do things proactively because I knew that before I came here, I will face some issues. I even received some formal presentations from like previous Turkish immigrants, Turkish researchers that visited other countries, and they shared some recommendations. But it's hard to know that before you come here and you face yourself with your own challenges, because yes, our issues are common, but everybody lives it and experiences it in different ways. So I should say that I really struggled in here in different times because of different things. Yeah, I reached different, how can I say, services, including like mentoring for like PhD study or counseling or different type of support or like healthcare services in here for my other health issues. But I should say that the main uh, the main um, the main supportive field, the main source of support for me. Maybe it's because of my character, I don't know, but definitely the social network I have in here or in Turkey. So the community you live in, yeah, I'm in contact with Muslims in here, and there are lots of Turks now in the UK. I'm in contact with them. But also, even in Turkey, we have some differences. So sometimes it's hard to find, how can I say, people that accepts you as you are, especially when you are living abroad. So I really struggled on times on that. Currently, I'm living in a apartment complex that has other Turkish families as well. So it definitely helps. I have two friends from university. We were roommates, and both of them doing their PhDs in two other countries. So we are talking on the phone very frequently. So yeah, it's definitely also supportive. My own family, I try to visit them still to by going to Turkey. Yeah, we call on the phone, but I think I still have the good opportunity, especially if you compare to the United States, being in the United Kingdom still has the opportunity to visit Turkey, maybe twice a year or something like that. It definitely helps. So I'm trying to do different things, but definitely the social network of your friends, your closest ones is the most important thing, I think, to be able to live in other countries. What would be great if it was provided by a social network from Turkey? I don't have any specific idea on that. I think being in HADI, this community, is one of the things that both supports me in my general life, but also keeps my interest on my research topic or on my field always. It's hard to keep that as well. So definitely HADI is supportive on that side. I would like to thank you, all HADI members, but especially the ones that I frequently contacted and moaned and cried about my studies. But generally, I think, you can call your friends time to time, or just very briefly, not in detail, but very briefly ask how they are, how the things going from time to time. They don't have to send long answers, but even how can I say, the feeling of being taught and being considered by others. I think it's important, especially when you're living alone abroad. I think those are my thoughts on the topic.
Thank you for both of you. We have 5 more minutes, and it seems like it's my turn because the direct correspondent of the question is me. For the first question, it's a really unique and new experience for us, and it depends your story, your case. I mean, if you are alone, or if you are with your spouse, or if you have children, the whole story has changed. And even if you are around your 30s, kind of middle age, it's a kind of starting a new life, like a newborn. And some of you know that for our cases, we are living in a city in Lexington, United States, in Kentucky, which we have very rare Turkish friends, or we don't have any strong Turkish communities. But alhamdulillah, we could remove the nationality as a barrier, and we got in touch with the international community, especially our Muslim community, Muslim brothers and sisters. And and we really felt like that. I mean, as a Turkish people, we already know that all places, all locations on the world only belongs to Allah subhanahu wa ta'ala. It doesn't matter where you are, where you live, but especially in the outside of the country, and especially in like United States or maybe China. I mean, the one of the farthest distance from our hometown, home country. It's a really chance to feel exactly that idiom or thought in your real life. I mean, we have really very helpful, supportive neighbors, community. We have lots of friends here, and all of them are internationals, especially the Muslim community. By the way, for example, some kind of disasters or extraordinary issues like earthquake. We were in the United States during the earthquake. It's not easy to handle those things. I mean, you feel very sorrowful, very sad when you are at the office or home, but when you're walking around the outside, everything goes similar. They don't need to change anything in their daily life. That was the hardest point during our experience. And for second question, I mean, what would be great if it was provided by your social network from Turkey. I mean, as Dr. Deniz and Dr. Özdemir said, our current technologies provides us many easy ways to communicate our friends and families from Turkey. And with the social media tools and other online meetings, online network groups like our society, we did not feel alone during those periods. But I mean, I can just suggest that if you have a friend in the outside of the country, especially if you are in the Turkey, it would be great to reach out them to communicate them without any specific reason or causes. Just a short text, a short phone call would be very great for them. These are all from my side. So if we have any other question, let me check the chats or QA. We can ask, or we can conclude our session in 2 minutes. So it's end of our session. Thanks for all presenters and participants to make contributions during the European Public Health Week. And our webinar series is not finished. We are going to continue until end of this week. Tomorrow we are going to listen to one of our colleagues, Dr. Seval Palteki. She is going to present us building livable communities insight into age-friendly cities. Then Thursday and Friday we will have another sessions. So thanks for your attendance and contributions. See you tomorrow. Have a great day.
Thank you. Have a good day.
Thank you. Have a good day.
Emanet olun.